Hello, this is procedure 52-4. This is installing medications into the eye without introducing pathogens. So the equipment you will need is latex gloves. I don't have any gloves, but I'm just gonna pretend like I have some. Medication with a dropper. I'm gonna be using this as my medication, and tissue to clean up the patient afterwards. So I am just gonna start by doing my procedure. So the first thing you need to do when doing this procedure, you're gonna walk in, you're gonna introduce yourself to the patient, and you're gonna explain to them what you're gonna be doing. So, hi, my name is Rosemary. I'll be your medical assistant today. I am going to be instilling medication into your eyes, both your eyes. Is that okay with you?
This is fine.
That's fine? Okay. Do you have any questions about this?
No.
Are you allergic to anything?
No.
You're not? It's very important to ask if the patient has any allergies, just in case. Ask them if there's any information that you need to know, which is why I kind of asked them, like, do you have any allergies or something like that? Because that will give me some information. Is there any information you need to give me? Like something you need to tell me?
I don't like needles.
You're not, this is not a needle. Alright, so basically what I'm gonna be doing is I am going to be installing these eye drops on both your eyes, alright? Not really, but I will, So once I explain to the patient what I'm gonna be doing, is it okay for me to do it?
Yes, it is.
Okay. Get the consent form from them to, so you're able to do the procedure. That's very important. Before you start anything and before, you get the once you get the medication, always look at the medication order, make sure it's the right medication, and get the right dose and everything. So for this is installing Alphagon P 0.2, 2 drops on both eyes. So I will put on my gloves, which I don't have any right now, but pretend like I do, and I will get my medication and my tissue. So can you just lay down on the bed for me, please? Thank you. Okay. So you want to make sure that obviously I would have usually a medication tray, but this is my room, so I don't. So I'm just gonna put it here for you. Thank you. So the first thing you want to do is you're gonna start with, since we're doing it in both eyes, make sure that if you start with the right patient's eye, ask them to tilt their head on the right side. And if you're doing it on the left side, ask them to tilt their head on their left side. Okay? Well, actually, no, never mind.
Is it the opposite?
No, just no, just keep it straight. Yeah, keep it straight. Never mind. So what I'm gonna do is I am going to install 2 drops in each eye. Okay?
Okay.
All right. So what I would do is I would take the medication. I would open it, and I would. If you want, you could just use one hand to hold the patient's brow and their bottom eye to keep their eye open and keep it from shutting. And then you would just insert the 2 drops, and you would ask, and then I would tell the patient, do not touch your eye. Don't touch it. Don't rub your eyes. Obviously, at this point, I put the drops on both eyes. I will wipe down their eye, from the drops. You don't want. Once you're done with that, You will ask them to have them lay there for like 10 seconds, 15 seconds until the medication has set in. The patient usually, their eyes are watering and all that, so once the eyes stop watering and the patient, cleans their eyes up and everything, then I will tell the patient, don't touch your eyes, don't rub them, try to keep your hands from touching your eye, just because you don't want to get it, you don't want to put dirt in your eye, okay?
Okay.
Alright, so I will ask my patient, okay? Are you feeling okay?
Yes, I am.
You are? Okay, perfect. So can you just stand for me? Oh, well, just stand up like this. You can sit down. How are you feeling? Are you feeling okay?
I'm good.
How are your eyes feeling?
Good.
They're feeling good? Alright. The rationale for this procedure is to make sure that we install the medication into the eye the best possible way without getting any bacteria in their eye or any dirt in their eye and stuff like that. And then special instructions might be completed. So special instructions that I told my patient is to not touch their eyes after the medication is in, so that they don't get their eye dirty anymore. The 7 rights of the medications, we need to make sure we have the right patient. Oh wait, I forgot to do that. I forgot to confirm who you are. That is really important. I forgot. Anyways, it's really important to confirm your patient, because you want to make sure that you have the right patient. In this scenario, I had Mary Smith, and her date of birth was February 5th, 1960. I forgot to do that. Make sure you double check that it's the right medication. Usually we do that once we're taking out the medication, once we do the medication, before we do the medication, and then afterwards. Again, we need to make sure that we have the right medication and the right dose, which this is the eyes, the right technique, the right time, and the right documentation. Once we are done with the patient, I will tell the patient if they have any questions for me, and then I will escort them out of the room, and I will make sure that I document everything that I did from when I set up the medication to when the patient walked in to when the patient walked out. Everything that I did, I need to make sure that I documented, because if I don't document it, it didn't happen. So I would document what medication I used, how much I used, what eyes did I use, that I used one, the right eye, the left eye, both eyes, which in this scenario, it is both eyes. How did the patient feel? Were they dizzy? Were they okay? Did the patient say they had an allergy or not? And everything that I basically did, I would document it, as well as what time did I do this. So this is like around 7 o'clock, so I did at 7 o'clock. The route that I did it was up, I can't say that word, it was the eyes. And I did the right dose. It was 2 drops in both eyes. It was 0.2, 2 drops in both eyes. And the right medication, which was the Alphagon P 0.1%. And it's 10 millimeter solution. And yeah, so that's how you do procedure 52-4.